So I did it. Welcome, everyone. So happy to have you with us today for our What the Health segment. My name is Mia Krishnaswami, and I've been a part of this wonderful company for about a decade. My husband joined me. He's actually on the Zoom as well. He joined me about 5 years ago. He was a good husband and has been on the products with me for as long as I've been a part of the company. We were introduced to this by my sister. And, in the beginning, we both have a background in the performing arts. So, in the beginning, we just wanted to age gracefully, better, be our own health advocates because people don't really start paying attention to their health a lot of times until it's gone awry. And so we really wanted to be preventative. There had been things going on with my parents and his, and so we were just like, let's do what we need to do to age more gracefully. And then you naturally just want to share that with other people. I mean, we all have our health in common. And if you don't have it, then can keep you from doing the things that are most meaningful to you. So that's a little bit about our story. And then today we have a wonderful guest with us, Robin Marquez. She's a licensed physical therapist with over 30 years in that profession. And, her life dramatically shifted with her own story of an experience as a cancer patient and survivor of breast cancer twice. Um, and wanting to just help other women live better lives, live their healthy, optimum selves. And that's really become her sole mission to help women just thrive and be on top of the things that can start to happen to us, especially, you know, if women have had certain things like breast implants, and Robin will share a little bit about that with her own story. But we definitely are gonna focus on the pelvic floor health today. But in the meantime, I just wanted Robin to share a little bit about her journey, to welcome her, just share a little bit about your story, Robin, and why, as a physical therapist, you have migrated into different modalities, looked into other options because the traditional therapies were not really supporting you and had their limitations. So welcome. We're so happy to have you with us today, and take it away.
Thank you, Mia. Thank you, Dawn, for inviting me to speak with everybody today. Thank you for that nice introduction. And as Mia said, I've been a physical therapist for well over 30 years, and I was not in the world of oncology, rehab, and physical therapy until I got my own cancer diagnosis. And from there, I went through the typical allopathic pathway. I underwent, some chemotherapy, some radiation. I ended up having, both breasts removed with mastectomies for the treatment part of it, which left me with a lot of physical limitations, which I did undergo physical therapy for. But then it wasn't addressing some of the side effects that I got from the actual treatments themselves, the chemotherapy. And the medication that I was put on afterwards was tamoxifen, because I had not been menopausal at the point. So at that point, I had a lot of problems. Part of it was with my upper extremity range of motion strength that came back, but nobody was addressing or even looking at my pelvic floor. And because of that, I was getting a lot of dryness and discomfort, and I was losing some ability to, I was getting some leakage of urine. So there was lots of things going on, and nobody was really looking at that and addressing it at the time. I wasn't referred to a pelvic floor physical therapist. Um, it was on my own search that I kind of came across some of these things. So I looked at a variety of different modalities in doing that. But during the time I was going through my practice, I was treating women and they were dealing with similar issues as well. So I was constantly trying to find products that helped with the internal dryness that people were having, and some of the resulting atrophying that was going on in the vaginal wall and in the pelvic floor. Not only were we having weaknesses, we have pelvic floor therapists that can address that. And I myself had become certified in doing that for my own interests, but then realized that there's a lot more people that were dealing with these side effects. And as me and I mentioned earlier, 1 out of 3 women report having problems with their pelvic floor during their lifetime, but that's a lot of people that don't even come forward and acknowledge that they have problems with their pelvic floor. And it's not just urinary incontinence. I mean, that might be a symptom of it. It might be pain. It might be discomfort with, intercourse. There's lots of different ways that it can present itself. It can oftentimes be more susceptible to infections, urinary tract infections, things like that, that put women at risk. And this is what we have to look at. So those of you that may not even be familiar with pelvic floor, problems and things like that, we'll spend a few minutes, talking about that in just a moment. But just to give you a little bit of input about when I started getting involved with LifeVantage, it really was not until my second bout with cancer, which was coming from, they found and determined it was actually coming from my breast implants. After having, I think I told you, the mastectomies, I did have silicone gel implants put in, and they had been in my body for a period of time. And what was happening, although they did not rupture, they were slowly releasing chemicals, and my body was responding to that in an autoimmune fashion, which is, we have a diagnosis of breast implant illness. So I was developing that, and that's what we finally discovered. So I did have them removed, and it was at that time I had started taking the Protandim. We hadn't yet come out with the liquid collagen until right before I had my breast implants taken out, but I had just started taking the Protandim to reduce my oxidative stress, because I do know most cancer patients have very high levels of oxidative stress. So I wanted to get that down. And really, that is one of the only product that I've come across in my own personal experience, the Protandim too, which reduces the oxidative stress by 40% in 30 days. So I was completely on board with that. So I was taking the Protandim. But at the time, my cancer had come back again. This is probably about 15 years later. And at that time, I knew it was coming from my breast implants. My, system was responding the way it was, and it was just localized to the lymph nodes in my armpits. So the doctor said, let's get the implants out. We decided we were going to do that. That was just about the time that the release of the new liquid collagen came out. I went to convention and I started taking that before I underwent the explant surgery, which was the removal of the implants. And I really can attribute my healing to a much shorter period of time. I did not experience as much discomfort with that. And the one thing that I was told by my plastics physician that did the surgery was that I was going to probably have to deal with some lymphedema of my chest and perhaps, my arms. I never had to deal with that. And so I was very grateful that I had the collagen on board. I do believe that helped with that. Because I didn't change anything else in my lifestyle, my diet. I was already eating clean. I was already exercising and doing the other things. So I have to, definitely attribute it to that. So that was a big perk. I got my range of motion back. I did not acquire any lymphedema, and I continued to use it. But what I didn't realize what was going to happen was I was using external products to help with the vaginal dryness. What I was pleasantly surprised with, that it also helped improve my vaginal dryness internally. And I didn't have to use the external moisturizers and things that I was using before. So that was a very welcomed positive aspect of the combination of doing the liquid collagen and the Protandim from a pelvic floor standpoint. But what I've also experienced with some of my clients is that while we're doing the pelvic floor exercises and therapy, it does require sometimes, in some cases, to do some internal pelvic work of the muscles, and sometimes there's scar tissue. When we are able to hydrate it from an internal standpoint, it's just that much more comfortable for women. It's not as, the therapy itself is not as uncomfortable. So that has been a tremendous help that I've noticed, and just in working with women that have been trying the product as well.
Oh gosh, wow. I mean, this is why we do this. So, for anybody who's new that may not be familiar with our products, the product Robin was holding up is this Protandem NRF2. It's our flagship product, and it's really what put us on the map. Um, this company, before it became LifeVantage, was a small biotech company with this incredible product. 40 years of research went into this product. And the formulator of this, Dr. Joe McCord, is the father of free radical biology. And it was when an ABC primetime investigative report done by John Quinones, I don't know, some of you may know who he is, you may not know who he is, but he's an Emmy Award winning reporter. And he went in to do an expose on this product because of what they were saying about it. He took a blood test on national TV. If you haven't seen that ABC report, please get back to the person that invited you to this discussion and they will share that with you. But basically, he takes a blood test on camera, and within less than 2 weeks, his oxidative stress levels had declined by 45%. And we are allowed to say, obviously, this doesn't cure, treat, mitigate any disease, but we are allowed to say that it reduces oxidative stress 40% in 30 days and up to 70% within 3 months with continued use. So there's nothing doing what this is doing. And of course, since that report aired, we've got all this independent research because these different institutions contacted Dr. Joe McCord and wanted to do their own research. And now if you go to pubmed.gov, you will see over 30 studies, peer-reviewed studies on this product alone. And I highly encourage you to do that if you're not familiar with that. American Heart Association never endorsed an all-natural product before. There's 5 studies by them. Harvard, National Institutes on Aging. So I don't need to go into all of that, but just to give you who might not know a little bit of info about that. And then this collagen that Robin talked about, we launched about a year and several months ago. And it has been a game changer in the collagen space. And why is that? Because LifeVantage is known as the activation company. So we are not bringing something to the cell that it doesn't have, that it's deficient in. We are turning on systems that have been compromised, be that from age, stress, other factors, and we're putting those back to work so that our bodies can do the healing work, and we're giving our bodies, we're activating God's pharmacy, if you will, within our bodies that maybe isn't working as well as it used to.
Especially, I
So
mean, that's a great point. Different phases in our lives too, because again, I deal with a lot of women and they may not all have cancer and stuff, but they're going through different phases, from adolescence to perimenopausal to menopausal. And, their body starts, making less and less. So we do need to help support it by activating again. And even women coming off of the birth control pill, it's been shut down for a long time. And if you're trying to reactivate systems, trying to rebalance hormones, it's very helpful when you can activate the body to actually do some of the processes that it naturally does. It just has gotten kind of lazy and been on vacation for a while. To reactivate things is the best, rather than supplementing that only does it while you provide the, product. So really,
yes.
it's amazing what we can get the body back to doing.
So, when you mentioned that, whether it's a woman that's been on birth control or a woman that's given birth,
Yeah.
and what can happen after that, or it's a woman that's older and going through menopause, and all of these hormonal things that are going on that affect our bodies and affect our pelvic floor health. And,
As
you
well
know,
as, right, our diet and all of the things we take in, our cosmetic product. I mean, it's all a part of it. But if we can actually do something on a day-to-day basis for our body, rather than waiting until we get a symptom to then go, it's so important. And that's what I tell my clients. It's like the best insurance that you can do for your health is something that you do every day that allows your body to maintain its normal systems and not to put things on hold. And that's what these products do. They reactivate our bodies to continue to do the processes that they were meant to do. And part of that is, detoxification, part of it's methylation, but you need to have low oxidative stress to do that. And you need to have your mitochondria supported. And that's why I was so excited that these products can address that. And yes, we get the silver lining of the cosmetic effects on our skin, but it's so much more than that.
yes,
That's
collagen is a
going
third
on.
of a third of the protein in our body is collagen. It's the connective tissue. It's between everything, our blood vessels, our ligaments, our bones. It's everywhere. And, before I took this, I never really had taken collagen before. And I always thought collagen was about our skin, hair, and nails. I had to be educated that it was about so much more than that. And it does affect our pelvic floor health. It does affect that hydration. Also, we want to
Dryness
make
in your eyes. Yeah, all of it. There's lots of different areas that are affected.
And our
Absolutely.
cell walls, we want to make sure that we're on a good omega plus, that our body is actually able to absorb these products. So many collagens are supplemental and they come in a form that our bodies cannot break them down and they can't be absorbed by our cells. And so you can take collagen till the cows come home, but if your body can't absorb it, you're wasting your money. So it does pay to understand the process of activation, because as much as we can't change our genes, we can influence how they act through everyday decisions that we make, and our long-term choices. Robin was talking about how we have to be proactive. We have to be our own health advocates and be preventative so that we can truly benefit our health in the most optimal ways. And on that subject, Robin, can we just segue a little bit and talk about, I think you've shared some about why this subject of activation versus supplementation piqued your interest, but how has it helped you? How has it helped your clients? I mean, you did share how it has helped you with your particular journey, but um, are there other modalities or specific products that, besides the Protandim NRF2 and the collagen? I know you mentioned mitochondria, and we do have three products in our Protandim family, and this one is activating mitochondrial biogenesis. Because mitochondrial dysfunction is also very much something that we need to pay attention to. It all works together. So we make more mitochondria, but then we got to clean it up with the Protandim NRF2. And then, this guy, which is Protandim NAD, that's bringing it all together. That's like the CEO of the cells and making these two work that much more efficiently together and creating that autophagy that is just making everything work in a much more powerful way. And we do have, patent on these three. And we're getting one on these two, and we did find out with our latest study that these two are increasing collagen density 100% within 60 days. That is incredible.
And
So
think about that as we age. I mean, we need our ligaments and our tendons to be strong, and that includes what's going on in our pelvic floor. We need those muscles to stay strong, to stay toned, not, for our, urinary health, for our sexual health. This is so important, as we age, to maintain that well-toned pelvic floor. And that's important for women and men, because that has to do with men and their ability to have an erection. And their pelvic floor and their ability to control their leakage of urine, because we deal with, some men that have prostate cancer as well. And so it's essential that the tone of those muscles, remain strong, but also to remain hydrated and good blood flow. So the more we can activate and allow the systems to bring the blood, to bring the nutrients there, and to bring the waste away from it, it's only strengthening and allowing us to maintain the viability of our pelvic floor, which really is our vitality center, in terms of aging well.
let me just ask you this. Can you get it back? Is it like if you lose it,
You
if you don't
can.
use it, you lose it? Is it that
You
kind of thing, or
do,
can
you
you get it back?
absolutely lose it if you don't use it. And that's the word that comes in, atrophying, where it's just basically a disuse condition where you stop using it and you start, seeing some of the effects. And, you can reinstitute blood flow. You can also bring better sensation to the area. There's different things that you can do for that as well. We happen to use infrared internal, dilators and vibrators and things like that. But I mean, there are ways that you can regenerate and bring sensation back. And then you can alternate in different areas of where you lack sensation and reroute to other areas. But a lot of that connection is between the mind and to, the pelvic organs, the sexual organs, as well as the exterior organs. So we do a lot of retraining with that as well.
So you use infrared modalities.
Red modalities, we use moisturizers, we would use, depending on, people, if they oftentimes, there's a condition called lichen sclerosis, which is the thinning of the skin in the, really in the vulva area, which is the area between the vagina and the anus, gets very, very thin, almost like tissue paper. And so anything that's going to help to improve the collagen and the elasticity and the pliability of the skin in that area is going to be beneficial for these, women. It's very uncomfortable even to just sit, and pressure on areas because it's very, very taut skin. So anything that we can do to help increase the blood flow, to activate more collagen to the area is going to be very helpful and very supportive from an internal level on them. So we can do whatever else we need to do to help, stretch the area to make it a lot more tolerable for people.
So you also mentioned that you do hormonal work as well, and
So
would you
we
like to just
test
talk about?
hormones and we look at hormone levels, and obviously, as they change, but it gives us a lot more information. It's not just about the lack of estrogen and the lack of testosterone, and progesterone. We're also looking at melatonin. We look at your neurotransmitters, and that's why, again, gut health is so important when we look at hormones, because hormones don't work independently by themselves. Hormones work in conjunction with our endocrine system and our autoimmune system. Much of that is happening in the gut. So rebalancing hormones involves looking at hormones, but it also involves addressing the gut. So sometimes we have to look at prebiotics and probiotics in the gut to really get, especially if they've been on antibiotics for either urinary tract infections or yeast infections, different things like that. They're going to have diminished good bacteria in their gut, and we're going to need to rebuild that. And then if we find out that they don't, we do genetic tests, we find out that they don't detoxify and methylate well, we have to prepare the system to be able to do that. And so again, these products come into play because they're working on activating, but they're also working on strengthening the existing mitochondria that are there. So they will be able to tolerate the whole methylation that goes on in the liver that's so essential about getting the hormones out of the body and clearing them from the body, especially the harmful xenoestrogens that we get in from our diet and from the red meat we eat and from the air we breathe. It's so important that our liver is able to break those down. And if you're at a what we call genetic disadvantage because you've gotten two gene mutations that don't work as effectively from your parents, we have to try to implement some other ways to help the body. And that's where some of Life Vantage really comes into play and helping people to do that.
Yeah, and that's why we're so passionate about sharing this. Yes, we want to be taking the products ourselves, and those that we love and care about, we want them to be on these products, but we want to share this because this is unique what LifeVantage has in the health space, in the field of nutrigenomics, and how we can turn on our body's ability, to activate gene expression through the nutrients and the nutrition that we bring to the cell.
And the good thing is that there's no real interactions with any other medications that my clients might be on. And so that's a big plus because, it's made from all whole foods and things. So I don't really have to, I feel confident in knowing that they can take that and still be on some of their other medications. It's not going to be really affecting that. So that's a good feeling to know that you don't have to be, as concerned about that, and that pretty much
Yeah.
everybody should be able to, to tolerate it.
Yes, and you did mention neurotransmitters as well, and I'm drinking my brain drink, which
Oh,
is
I got
basically
right here.
our Axio drink, which is basically it helps with mental clarity, focus, positive mood, energy, and I drink at least two of these a day, because it's been a game changer for anyone that has, even children with ADD, ADHD, autistic spectrum, disorders. This has been very, very instrumental in just helping to bring more clarity and power to the brain. There was a question. Somebody, Jan Smith, was asking where you're located. She's located in Chestnut Hill, Massachusetts.
Actually in Wellesley,
Oh,
Massachusetts.
sorry.
So that's okay. We used to be in Chestnut Hill. We're in Wellesley, Massachusetts. I'm on 148 Linden Street in Wellesley, Massachusetts. And our practice is called Circle of Wellness for Women's Health and Cancer Care. Don't have to have cancer to come here. We do a bunch of women's wellness preventative screening options. We look at thermography, which is another modality to look at, particularly for women that have dense breasts. It's an alternative where there's no radiation exposure. We'll let you know if you have any warm spots in that area where there's an increase in temperature. From there, we may follow it up with an ultrasound. The two together, thermography, contact regulatory thermography, and ultrasound are 97% effective in finding early thermographic changes, which could indicate an increase in blood flow or a potential early sign of clustering of cells. This is the best time to really look at that when we have things that we can put in place that can help to do some reversal. So we don't just look at the breast, we look from head to toe on that. So that's been very beneficial. We do the hormone testing and some of the genetic testing as well, to help women to do that. And then we also, implement scar management. We do lymphedema care for anybody that has problems with the lymphatic system. We need to have our lymphatic systems working well in order to drain and remove all the toxins that we take in on a day-to-day basis. We have to stress how important it is. What you do every day matters, because that is the cumulative effect. It's no longer good to say, well, I go to the doctor every 6 months or every year. It's just not enough time because we're exposed to so much. Our world now is not as clean as it was. And so what are we doing? You need to ask yourself, what are you doing on a day-to-day basis that helps to strengthen your health? What are you doing from the outside and what are you doing from the inside?
It's so important. I just happen to be aware that since the Industrial Revolution, we've had about 85,000 chemicals introduced into our world, and the US has banned 11.
Amazing. Europe is so much more, ahead of us in terms
And
of
we wonder why we have so many sick people. And, I mean, it's just so important to take our health into our own hands. And yes, you can take the collagen every day. It's my most favorite moment of my day. It's taking this, I drink it down. I've already had mine today, and then I fill it up with water because I want to get all the,
I
I
do
want
too.
to get it all. And it's yummy tasting and it's activating 10 different types of collagen, where most of them on the market may be supplementing one, two, three at the max types of collagen. And it's marine peptides. It's delicious.
I have to agree. I tried several different ones and I had tried some of the powdered ones stuff and they weren't tolerable, in terms of their taste, but they weren't that effective either, you know? So I think that's a nice plus with that. And then also, a lot of times women will say, not particularly people that have lost their hair due to chemotherapy, but people in general who have hair thinning because of thyroid issues and things like that, they do feel like the collagen and the combination with reducing the oxidative stress from the protanda together has helped with their hair growth and their nail growth as
Yeah,
well.
I mean, we really do. We're going to wind it up here because we've been on almost 30 minutes, but we really do have to become our own health advocates. I happen to know Robin, personally, and I know that through the thermography program that she does, that's how she found her cancer the second time. The
I'm
mammogram
grateful
didn't
to
find
that.
it. The mammogram didn't pick it up. She found it. And so we really have to be educated on what we can do to empower our bodies, to empower our pelvic floor health so that we can live a robust, vital life full of vitality. And there's no reason why that can't be the case as long as we know the tools that we can use to to create that kind of optimal health.
Be active participants in your own wellness is really it. And if you're not getting the right answers, if your doctor's not addressing, that's what would happen to myself. I wasn't getting my pelvic floor, concerns addressed. Nobody was putting me in the right direction. I had to seek, my own information, but that's what we're saying. You do have to be your own advocate. And sometimes, if you're not hearing the answers you need to hear, go to the next person because there's plenty of people out there that can help you. I mean, pelvic floor therapists, are a specialized a group of people that are board certified. Not every physical therapist does pelvic floor, so ask these questions when you're really evaluating. If you're having issues with your pelvic floor, make sure you get to somebody that really does that all the time.
Yes. Well, Robin, you are a wealth of of information, not inflammation, a wealth of information to reduce inflammation. And so, anyway, we thank all of you for joining us today and join us again next week. I don't know exactly what the health segment will be next week and when it will be, but just stay tuned because we'll get you that information. We so appreciate you joining us, and if you want to share this with anyone, and you're in that Vitality Living Facebook group, then we can tag you. You can tag whomever you want to.
Yeah, and I will put my website on there too. If anybody has any questions, feel free to reach out. I'm happy to answer.
Yes.
Mhm.
Thank you so much, everyone. Thank you, Robin, and have a blessed day.
Thank you.